my heart is really full right now because we're very, very fortunate, I think, to know that we have these amazing initiatives like the African American Health Program, the Latino Health Initiative. Our Asian community has an initiative. I mean, they've been working for a long time to address a lot of these issues and examine the data, and they have been informing us for a very long time. And I think with the passage of the Racial Equity and Social Justice Law, as well as the resolution declaring racism, a public health emergency, it has brought into focus, in my opinion, something that it's so complex and it's such a challenge. But I really feel very, very happy that we have been able to come together so quickly, examining the data to then put forth these types of templates that I just know will have a very important impact in addressing these issues. And thank you so much, Councilmember Rice and Jawando. You've said it well. It is the same, approach that we need to have, that this can become then the template of how we address these issues going forward. Because at the end of the day, in my opinion, it is so much more cost effective. The results will be much more comprehensive because we're leveraging so many things and we're doing it in a systems way, not in a piecemeal approach. And it's also takes into consideration specific issues that particular communities need. And so in that way, it's adaptive, and I believe can definitely be a model for how we do a lot of other things. Ms. McMillan is just extraordinary. I mean, she has been pulled in so many different directions, and basically said, here is this proposal. What do you think? And she's able to fine tune everything. So I am so appreciative of Ms. McMillan and all of our staff for working around the clock, as you've said, to bring this forward. And now I can't wait for it to be implemented and for us to be able to also evaluate the impact as we continue. So kudos to everybody that worked so hard. And I'm really pleased that, in this meeting during recess, that we are approving this because our communities really need this, but our county really needs this because it is not just about addressing issues in a community that's proportionally affected for the sake of that community. This is public health that we're talking about. So if we are too complacent and we don't address those issues, it is absolutely going to affect the rest of the county and the rest of the communities. And so that is our goal, and I think that this is definitely the right way to go. So thank you to everybody. Congratulations on getting this done in record time, and I'll be really happy to raise my hands.